When it's good with Will, it's really good. He's just a sweet, loving, wants to be loved kind of kid.
What are you doing, Will?
Family home video shows a young Will Rollerson full of joy shortly after his adoption 18 years ago.
We had a lot of great experiences.
His father, Adam, says when he and his wife brought Will home, they knew he suffered from autism, a heart condition, and multiple developmental disorders.
But at 5 years old and about 35 pounds, he was just a cuddly little joy to be around.
Now, 23, Will's challenges as an adult have turned into safety concerns, destroying property and showing aggressive behavior towards Rollerson's biological children.
We just weren't willing to take that risk.
In 2016, Rollerson searched for a facility to care for his son and found this Lawrenceville, Georgia home operated by Exceptional Community Services. It's state licensed to care for the mentally disabled. Within months, Will's father noticed bruises on his face and neck. A state investigator later cited the company with neglect for failing to report Will's injuries. Rollerson then requested a meeting with the facility owner.
And I said in that meeting, I'm just waiting for the next call that something serious is going to happen, and within a few days it did.
These are pictures of Will in the hospital with a broken arm. Exceptional claims it happened after Will accidentally tripped while running to his room. Surgery to repair the break led to an infection that almost cost him his life.
We almost lost him.
Rollerson is suing Exceptional, claiming it failed to properly care for Will. An attorney representing the company denies the allegations, emailing us, "We look forward to complete vindication in court." According to state records, from 2017 to last year, Georgia experienced a nearly 40% increase related to abuse, neglect, and exploitation claims at mental health care facilities.
Safety and health, that's of the highest priority for the department.
Judy Fitzgerald is the commissioner of the Georgia Department of Behavioral Health and Developmental Disabilities, where the Reveal obtained its records.
So I know that you collected a lot of raw data from our department, and I can't validate necessarily what you collected from an open records request.
I provided it to you, and you had an opportunity to validate it and tell me whether the numbers are right or not. So are you saying that the increase isn't real?
So you pulled data across a lot of different systems.
The commissioner never answered our question, but did say an increase could be attributed to improved reporting measures recently put in place.
So an uptick in the number of critical incidents might not be a bad thing.
What is bad is Georgia's long history of poor treatment of its mentally ill. In 2010, the U.S. Justice Department sued the state for failing to provide appropriate housing for its developmentally disabled. Today, the state remains under federal supervision.
I unfortunately think this abuse has probably been pervasive for years.
Brian Gerard is an attorney who represents individuals with developmental disorders. Joey Kaysen is currently one of them. In 2013, the 55-year-old disabled man moved into this facility in Gordon, Georgia. Cameras inside recorded one of the worst cases of abuse Gerard has ever seen. That's Joey sitting in the back. Watch as one of his care providers walks over with a belt, hitting Joey 30 times.
I think anybody would find the video despicable.
Police charged the woman with abuse. The state revoked the facility's license. An independent reviewer hired by the court expressed similar concerns last year. While it praised Georgia for its substantial investment of resources, it also criticized the state, writing, "There continues to be widespread concern about the lack of available resources for individuals with complex behavioral needs." Still failing more than 9 years after the Justice Department's lawsuit.
The independent reviewer, when she first came in, said transformation of the kind that you are undertaking usually takes about a decade. We feel that we have reached that level of transformation where we no longer need federal oversight.
Will's father disagrees, not just as a parent of a special needs child, but as a longtime psychotherapist who has worked in Georgia's mental health care system for 17 years.
If you could tell the commissioner anything, what would it be?
I would tell Will's story from start to finish. I would show her the pictures. I would ask her the question, what more can I do as a parent to try to help my son?
Matthew was wonderful, sweet, very compassionate.
At an early age, Matthew Bowler never shied away from attention or showing affection.
He would always give me big old hugs.
His mother, Dorothy Berry, says he excelled in sports.
Matthew played football, basketball, and baseball. And he was a champ at each sport.
But when Matthew turned 19, something changed. Something wasn't quite right.
What happened?
He started changing. He started getting quiet, staying more to himself.
In 2016, an argument with his sister led to a fight, breaking car windows. A judge ordered a mental evaluation, and a doctor diagnosed Matthew with schizophrenia. A short time later, the 22-year-old Stone Mountain man was sent here, Georgia Regional Hospital, a state-run facility which treats mental illness. Barry was nervous about the idea.
But I wanted my son to get better. I wanted to find out what was wrong with him. I wanted to know what was going on with him.
Turns out she had good reason to worry. 6 months later, staff found Matthew unresponsive in his bed, dead. A 2017 state investigation shed little light into what happened.
They tell me that Matthew was woke at 6 to take medication. Autopsy said, and the state said that when they touched Matthew, he was cold to the touch. Now, if your body cold to the touch, I'm sure you had to be dead for a while.
The investigation cites conflicting reports of Matthew's time at Georgia Regional. Some staff said he was taking his medication, even smiling months before his death. But the report also indicates Matthew was so miserable, he begged to go back to jail and tried to hang himself. The medical examiner's office ruled Matthew's death not entirely clear, unexpected.
Are you okay with potentially never knowing what happened to your son?
No, I'm not okay with that. I want to know what happened to my son. I think I deserve to know what happened to my child.
A Reveal investigation uncovered similar deaths ruled unexpected have increased nearly every year at Georgia facilities licensed to care for the mentally ill. Since 2014, more than 500, according to state records.
I did not know about those numbers. Those numbers are astonishing when you look at them on any level.
Eric Jacobson is the executive director of the Georgia Council on Developmental Disabilities, an advocacy organization.
It begs the question about what's the state going to do, what are providers doing, why is this happening, and what can be done to rectify the situation.
The state's poor treatment of its mentally disabled stretches more than a decade, from dozens found dying at state hospitals in 2007 to a U.S. Justice Department lawsuit that led to federal supervision of Georgia's mental health care services today. According to a 2018 report submitted to a judge by an independent reviewer, Georgia continues to take too long investigating deaths, saying, until fixed, the system cannot be described as effective.
We don't think that we need federal oversight anymore.
Judy Fitzgerald is the commissioner of the Georgia Department of Behavioral Health and Developmental Disabilities. She says the state has overhauled its mental health services since the lawsuit and wants federal supervision to end.
Why should the public trust you that you can move forward protecting these vulnerable populations when that independent reviewer says you haven't quite done it yet?
What she has said is we're not doing it fast enough. When we do a review, and I will stand by our department's work, we have very, very thorough and comprehensive policies and protocols about what happens when a vulnerable individual experiences an incident anywhere throughout our system. We just believe we don't need federal oversight to continue that work.
Do you agree with that?
No, I think that the DOJ needs to be remain here.
And these are just little pictures I had of them.
A family searching for answers, haunted by memories of a son begging for help.
When I would call him, I could hear him kind of crying in the background, telling me to get him out of there.